The CDC says coronavirus shutdowns may have increased the country's risk for Legionnaire's disease. The CDC says water left standing from businesses forced to close during the pandemic can cause conditions that increase the risk for Legionella and other bacteria. There is no vaccine for the disease, but the agency is advising building owners to maintain water systems in order to reduce the risk. The bacteria even affected the CDC, which had to shut down several of its Atlanta area buildings because of Legionella bacteria in their water systems. A sushi restaurant in San Francisco has come up with a unique way to keep customers safe when dining outdoors. They set up giant translucent domes that cover their restaurant tables. The owners of Sushi Hashiri felt the domes were a fun way to help people stay socially distant while dining outdoors during the COVID-19 pandemic.
We thought it was a great idea. We haven't seen any other restaurants do it here in the Bay Area, so might as well jump onto it and make the first out of it.
The restaurant works to keep the bubbles clean and sanitized and hopes to add more domes soon. The Bill and Melinda Gates Foundation is teaming up with an Indian lab to develop an affordable coronavirus vaccine. Serum Institute of India says it will produce up to 100 million COVID-19 vaccine doses for low and middle income countries as early as 2021. Once developed, the potential vaccine is expected to sell for $3 a shot, making it a cheaper alternative for developing countries. Warnings from key health organizations about cigarette smoking and how it may add to the spread of the coronavirus. Dr. Albert Rizzo, Chief Medical Officer for the American Lung Association, says smokers can exhale infected droplets into the air while breathing out smoke. Those droplets could spread to others when exhaling the smoke. The CDC also says secondhand smoke can complicate the risk by reducing lung function, inflaming asthma, and causing heart disease, lung cancer, or stroke. A doctor in Florida is warning of the damage COVID-19 can cause to the heart after saving a young man from heart failure after he contracted the virus. Fox News' Alina Shirazi reports.
What's going on? What's happening? Like, why this? Why now? I'm just 21.
These are questions Jose Flores asked himself a few weeks ago when he was fighting for his life in a Florida hospital.
I got into an induced coma where I was in shock. So I don't really remember after when I got in there, I was on the phone with my mom. I don't even remember any of that.
COVID-19 didn't cause Flores lung problems. Instead, it hit him in his heart. Dr. Alan Stewart says his patient had massive heart failure.
He's a 21-year-old kid who has really no other issues. So he's a kid who's not supposed to die.
Stewart says he had to make a quick decision to perform an emergency procedure that saved Flores' life.
Myocarditis, or inflammation of the muscle of the heart, prevents that heart from squeezing, from doing its job. So what we did is we put a device right into the heart, across the heart valve, to take the place of the heart temporarily and allow the heart to heal.
Within 2 days, Flores started to make a full recovery. Stewart says this young man's story shows the important link between the virus and direct heart damage, something he wants people to take seriously.
And now we're learning as time goes on, well, geez, there's a lot of other problems associated with this virus that could affect the heart individually, not just as a consequence of affecting the lungs.
A recent study shows that 78% of recovered heart patients have ongoing heart damage, inflammation, and structural changes to their heart. In Miami, Alina Shirazi, Fox News.